best products to be used in the morning is of course your moisturizer, one thing. Number 2 is your sunblock. Sun protection is different for different skin types. For the oily skins, it should be the water-based sunblock. For the dry skins, it should be the creamy sunblocks or the creamy lotions with a broad spectrum, and I think SPF 50 is sufficient for you. It is very important to apply the sunblock when even you are inside in your house, sitting in your lounge, because your windows are not filtered. So there's a possibility that the UVB light can come, and very important thing, your phones has got the blue light in it. So your most of the time is in front of your screens, which makes it more obvious that you become more darker or your melasma becomes aggravate when you have more exposure to your phone screens. So it's important to wear your sunblock even you are inside your house. Well, the homemade products, I think most of you people might trust the herbalist more than a physician, which is wrong. Different skins have different sensitivity ratio. So I prefer, if you use the homemade products, it should not be the acidic nature and it should not be applied on the skin which are very sensitive. What I believe कि homemade products जो आप use करते हो वो बेहतर है खा लिया करो rather than just applying on the skin. And one of the basic things that I tell to my patients in a layman term is jaw ka atta and chawal ka atta for refreshing your skin, and use it just like you use the scrubs, and that's beneficial. Best product or the best regime for your night is that cleansing first. Apply the retinoids one night along with the Q10 enzyme, because the pure retinoids might sensitize your skin and can create a purging out of the acne. Number 2 is vitamin C, and a very blended vitamin C that is along with the moisturizers, which is in the form of the ferulic C. My brands that I really love to prescribe to my patients are Murad retinoids, SkinCeuticals ferulic C product, Dermaster retinoid are the top list products that I recommend to my patients. Usually the products that you order online are very mild. They are not very strong products. So the checking of sensitivity is, take a small amount of the product, apply it on the back side of your ear and see if there is any redness, any itching, any signs of inflammation, and you feel it's a little scratchy. So this means you are sensitive to that product and do not use it. This is a very good question, very important for all of you to listen. जब आप प्रोडक्ट बहुत ज़्यादा कोई लगाते हैं, एक सर्टेन स्टेज पे वो प्रोडक्ट आपको रिस्पॉन्ड नहीं करता क्योंकि एक थिकेस्ट लेयर बन जाती है स्किन की, विच यू ऑल नो और वी ऑल कॉल इट इन लेमन टर्मिनोलॉजी डेड सेल, हम जिसको कहते हैं, स्ट्रेटम कॉर्नियम बन जाती है। आपको जो एक्टिव इंग्रेडिएंट होता है वो 60% वो डेड सेल्स खा रहे होते हैं और 30% डीप डाउन द लेयर जाता है, जिसका मतलब ये है कि वेस्ट ऑफ प्रोडक्ट। इट इज़ वेरी इंपॉर्टेंट टू गेट द एक्सफोलिएशन लेजर्स 3 महीनों में एक मरतबा for better penetrance of that product and for the better efficacy. So it should be done in a good clinical practice where they see the safety protocols for the patient's skin. It's a little bit of long debate. Yes, there are 2 types of the aging factors, which is chronological, biological age. It definitely depends on your crash tightings, that you might reduce, lost your superficial fat compartment, your habits in life, your quality of life, your stress in life, everything matters a lot. And the night regimes, because those people who actually invest on the skins, on a gentle procedures which are needed in their life, are definitely preserving their aging factor more as compared to those who are just letting it go. There are 2 phenomena for the aging. One is to preserve what you have, and the other is to let it go. So the decision will be yours.